I think these federal charges are a major overreach. When you look at people who have killed far more people than Luigi Mangione allegedly did, many of them did not get the death penalty. Many of them, it wasn't even on the table. Somebody who allegedly killed a for-profit health insurance industry CEO, the biggest one in the country, that has purchased a whole lot of politicians on both sides. They want to throw the book at him and give him the death penalty, terrorism charges. That's beyond a slippery slope. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan with Status Coup. Luigi Mangione, the alleged shooter of UnitedHealthcare CEO Brian Thompson, has broken his silence, and he is thanking supporters for their support, which he says he is overwhelmed and grateful for. This was on a new website for his criminal defense that was created. Let me read this to you. There is other news related to his case, but this is the first time he has spoken from jail publicly. This is Luigi Mangione, legal defense information. The URL is luigimangione.info.com. Homepage, due to the extraordinary volume of inquiries and the outpouring of support, this site was created and is maintained by Luigi Mangione's New York legal defense team to provide answers to frequently asked questions, accurate information about his case, and dispel misinformation. The intent is to share factual information regarding the unprecedented multiple prosecutions against him. Here's a message from Luigi. Quote, I am overwhelmed and grateful for everyone who has written me to share their stories and express their support. Powerfully, this support has transcended political, racial, and even class divisions as mail has flooded MDC, Metropolitan Detention Center, from across the country and around the globe. While it is impossible for me to reply to most letters, please know that I read every one that I receive. Thank you again to everyone who took the time to write. I look forward to hearing more in the future. Luigi Mangione. I'm not going to, psychoanalyze this, but if you want to, maybe take a guess what the defense of him will be and what some of the themes will be, I do think the fact that he said powerfully this support has transcended political, racial, and even class divisions. Obviously, this statement most likely would have been approved by his legal defense team. I said for a while now, I think his best defense is not insanity or anything like that, but putting the predatory for-profit health insurance industry, which is killing a whole lot more people than Luigi Mangione allegedly did, put the health insurance industry on trial because the health insurance industry's predatory practices, which I've gotten flooded with stories as well to our email at info@statuscoup.com. We've tried to interview people about their healthcare horror stories. It transcends, like Mangione said, political, racial, class divisions. So I think that's going to be a theme in his defense. I think if his legal defense is smart, which there's no reason to think they're not, they are going to put UnitedHealthcare on trial. They are going to put the whole damn for-profit, predatory, murderous health insurance industry on trial because all it takes is one. All it takes is one juror to hold out. You could have a mistrial. You could have jury nullification, which we've talked about here, which is essentially kind of a jury thinks that the defendant committed the crime, but basically, give him or her a pass thinking it was justified. That's not the legal definition, but in practice, that's what it is. So now that Mangione has spoken, let me update you on the case, because as I record this, which is on Saturday, February 15th, we could see a federal indictment by Monday. So there has not been a federal indictment yet against Luigi Mangione. This is from January. Court proceedings for man charged in UnitedHealthcare CEO's killing delayed several weeks. The lawyers agreed in a letter to the court that the deadline to bring an indictment against Luigi Mangione can be extended from January 18th to February 17th. So that would give the federal prosecution, the government, which in this case would be the Trump administration, until Monday. Mangione is now charged in a criminal complaint, a document that is lodged against individuals prior to the return of an indictment. So I do think the timing of this Mangione statement, although I think what he said is probably from the heart, the timing right before that deadline, I'm assuming his lawyers fully expect an official federal indictment to come on Monday against Mangione. And as part of that federal indictment, we know the terrorism charges, which are unprecedented, I think insane and dangerous for all of us. And legal experts have said that they believe that is an overreach to charge him with terrorism. And I have interviewed folks on the ground who might not necessarily condone what Mangione allegedly did, but certainly, New Yorkers were not feeling terrorized at the murder of a big-time healthcare CEO. So let me also show you, I think this is interesting. So 11 days ago, this was on February 4th, you had an article from Newsweek, Luigi Mangione's top donors fizzle out. At the time, 11 days ago, his fundraiser, which is through the website Give, Send, Go, had raised $228,000. Well, 11 days later, there was a spike after Newsweek wrote that story. So Newsweek, maybe unintentionally, helped surge donations to him. 11 days later, the fundraiser is now at $426,000, getting closer to that goal that they put up of $500,000. So in 11 days, he's raised almost $200,000 more after that Newsweek article saying that essentially, funds and donations were drying up. So, I guess they should thank Newsweek for helping it spike. And again, this is through Give, Send, Go, and it's close, about $75,000 away from that $500,000 donation mark that the legal defense asked for. And a couple of days ago, his attorneys formally accepted the donations, thanking whomever donated. Recently, also, his criminal defense team added a pretty well-known, renowned death penalty expert. A federal judge in New York on Tuesday appointed a death penalty expert to the defense team of Luigi Mangione, the man accused of gunning down Brian Thompson. Judge Catherine Parker, in a brief, approved the appointment of Avraham Markowitz, an expert in capital cases. The Agnifilo Intrader team is pleased to have Avi Moskowitz lend his considerable expertise in death penalty cases to Mr. Mangione's federal case. As learned counsel, the charges could not be more serious, and our client needs every resource at his disposal to fight these unprecedented charges in 3 jurisdictions, his legal team wrote in a statement. Mangione pleaded not guilty to the 11 charges in the indictment, including first-degree murder in furtherance of terrorism. So, obviously, the feds came in because New York outlawed the death penalty years ago. So the federal government charges, in part, were to put the death penalty on the table. That's why his legal team is bringing on a death penalty expert, which, again, I think these federal charges are a major, major overreach. When you look at people who have killed far worse, far more people than Luigi Mangione allegedly did, many of them did not get the death penalty. Many of them, it wasn't even on the table. It's interesting that somebody who allegedly killed a for-profit health insurance industry CEO, the biggest one in the country, that has purchased a whole lot of politicians on both sides, they want to throw the book at him and give him the death penalty, terrorism charges. That's beyond a slippery slope, because what's next? Who are you going to charge with terrorism next? You're going to charge people who don't actually kill anyone with terrorism? It could. And meanwhile, UnitedHealth, who, as I've reported, is freaking out and lashing out at the support that has gone across political lines against Luigi Mangione. A federal judge has ruled that a case against them for their predatory, fraudulent AI practices, how they're using AI to deny patient claims. Their AI deployment has a error rate of 90%. a judge has moved this lawsuit against UnitedHealthcare forward. This is Medicare Advantage enrollees sued them who were denied necessary care by algorithms, don't need to finish the appeals process, the judge says. Medicare Advantage beneficiaries who are suing UnitedHealth Group over allegedly wrongful denials of care that were based on artificial intelligence scored a victory Thursday as a judge ruled their case could move forward. There has been a stay on discovery in the case since August, meaning the attorneys representing the Medicare Advantage enrollees and their families couldn't poke around and ask to see internal UnitedHealth documents. But this decision could reopen that process. UnitedHealth and attorneys representing the beneficiaries did not immediately respond to questions. If you don't know about this lawsuit, this was from November of last year, November of 2023. UnitedHealth uses faulty AI to deny elderly patients medically necessary coverage. The lawsuit claimed the elderly and prematurely kicked out of care facilities nationwide or forced to deplete family savings to continue receiving necessary medical care, all because UnitedHealth's AI model disagrees with their real live doctors' determinations, according to the complaint. Medicare Advantage plans, which are administered by private health insurance such as UnitedHealth, are Medicare-approved insurance plans available to the elderly people as an alternative to traditional federal and health insurance plans. The use of the allegedly defective AI model developed by Navi Health and called NH Predict enabled the insurance company to, quote, prematurely and in bad faith discontinue payment to its elderly beneficiaries, causing them medical or financial hardships, the lawsuit states. So this is going to move forward. And by the way, UnitedHealth, Brian Thompson, the slain CEO, was very, very involved in accelerating the deployment of AI to deny the elderly and scam the elderly, not just the elderly. There was others, not elderly people denied through AI. Many of you might have been denied through AI by United and other health insurance companies. But after he was killed, who did UnitedHealth replace Brian Thompson with? The head of their Medicare and Medicare Advantage division. So they just swapped out the guy who accelerated the deployment of AI with the guy who was running their predatory, fraudulent Medicare Advantage division. Clearly, they've learned and are ready to reform from the murder of their CEO. On top of that case going forward, as I reported earlier in the week, you might have missed it, UnitedHealthcare is mad about "In Luigi We Trust" comments under a doctor's viral post. So we've reported on Dr. Elizabeth Potter. She is the Texas doctor who basically was called mid-surgery. You got to call UnitedHealthcare back right away. And UnitedHealth basically wanted to deny her patient who was mid-surgery care. I mean, you just can't make this up. UnitedHealth wanted to deny her patient care because she had requested an inpatient hospital stay. This was a breast cancer patient. Through my research, it seems like not all cancer surgeries require an inpatient stay. I would say most do. This one most certainly should have required an inpatient overnight hospital stay. On January 7th, Dr. Elizabeth Potter, a plastic surgeon in Austin, Texas, posted a video on social media that went viral. To hear Potter tell it, she was in the middle of surgery when someone from UnitedHealthcare called her office on the phone and demanded to talk to her. Quote, I had to scrub out mid-surgery to call United, only to find that the person on the line didn't even have access to the patient's full medical information, despite the procedure already being pre-approved. She wrote under the video explaining the situation. Let's show that video.
2025 and insurance just keeps getting worse. I just did 2 bilateral deeps and 2 bilateral tissue expanders for patients. And I've never had this happen before, but during the second deep, I got a phone call into the operating room saying that UnitedHealthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And, said I had to call right now. So I scrubbed out of my case and I called UnitedHealthcare, and the gentleman said he needed some information about her, wanted to know her diagnosis and whether her inpatient stay should be justified. And I was like, do you understand that she's asleep right now? And she has breast cancer. And the gentleman said, actually, I don't. That's a different department that would know that information. And I was like, well, she does need to stay overnight tonight. And you have all the information with you because I got approval for this surgery. And I need to go back and be with my patient now. But yeah, it's out of control. Insurance is out of control. I have no other words.
Well, UnitedHealthcare doesn't like it. They were so upset about the video that they contacted a heavy defamation law firm to basically send her a nasty 6 or 7 page letter threatening basically to bankrupt her if she didn't take the video down and make a public apology to them. The good doctor basically told them, take a hike. So essentially now in that letter, they specifically said that UnitedHealthcare was upset, referencing numerous comments such as "In Luigi we trust" and "Need more Luigi" were posted in response to your false claims, attempting to justify the assassination of UnitedHealthcare CEO Brian Thompson. So, "In Luigi we trust," that's very triggering for UnitedHealthcare. They also formally complained to the Securities and Exchange Commission when Bill Ackman, a hedge fund magnate, now a big Trumper, I'm not a big fan, but he said, he publicly tweeted, yeah, I would short, meaning bet against in stock trading, bet against UnitedHealthcare. They formally complained to the SEC about that. So they're writing 6 or 7 page letters threatening doctors, we're going to bankrupt you if you don't take this video down and public apologize, even though we yanked you out of your surgery with a breast cancer patient to try and deny that patient care. By the way, they did deny the overnight stay for the breast cancer patient. So obviously we're going to follow this as best as we can. There very likely is going to be a federal indictment against Mangione as soon as Monday. And from there, we'll see if there's news on when the actual trial and case will advance. I'm assuming the prosecution, if they actually have him dead to rights, like they say they will want a trial very quickly. We will try to cover it as much as humanly possible. Please support Status Coup and our independent on-the-ground reporting. We will try to cover it on the ground for as low as $5 a month. StatusCoup.com/join.